service programs like AmeriCorps and Senior Corps do a lot of great work with Habitat for Humanity, Teach for America, City Year, Red Cross, just to name a few. And you've gone on record as opposing those, but over the years, since they were started back in the early 90s, John McCain, Haley Barbour, both President Bush's, they've all gone on the record as being strongly in favor of AmeriCorps and national service programs. So just wondering if, elected president, you might make that a part of your agenda, and if you think it's a good idea during this economy to take away opportunities for young people to serve their country.
Well, it isn't the idea of young people not serving their country. The point is we're broke. I don't know if you all have gotten that message yet from me this morning, but let me state it clearly. We're broke. We are broke in this country and we're bankrupt. So just consider, we spend 100% of everything that we have, but we spend 40% more than what we have. So think about that for a moment. That's reality. We're not talking about monopoly money. We're not talking about debts that your parents are going to pay off or that your grandparents are going to pay off. We're talking about debts that you're going to pay off. You see, you are the first generation in 235 years of our history that in all likelihood will see a much reduced standard of living than I ever knew or that my parents ever knew. You have to realize what you're walking into. You're walking into a reduced standard of living. Why? Because the tax rates will be so high, wages will go down, job possibilities will go down. It'll be far more difficult for you to be able to buy a home or buy a car or be financially independent. That is not the future that I want for you. I want you to have the future and the options that I had, even greater. Because if you ask your parents or your grandparents, or if you look back to generations, I can remember back to my great-grandparents. They lived up in Forest City, Iowa. And I remember my parents did better than my grandparents. My grandparents did better than my great-grandparents. And my family goes all the way back to 1850 here in Iowa. I'm a seventh-generation Iowan. Every generation did better financially than the generation before. Yours is the first generation that in all likelihood, because of this massive debt that we have, and because we have to pay back the debt, and because we can't see the job growth because of the debt, yours is the first generation that in all likelihood will have a marked reduced standard of living. That's not good enough for me. I am not willing to stand by and see it happen. And that's why I was shocked as a 31-year-old young mother holding that baby who is now 24 years of age. I saw what was coming. And that's why I got involved. Because I did not want to see our country go down the path that it's going down now. You have to grasp this. 2012, in all likelihood, is the last exit ramp for the United States to regain economic prosperity and growth. Why do I say that? Because we've now passed, and we have in law, Obamacare, which is socialized medicine. We've never had that before in the history of our country. It's a brand new entitlement program that came at the worst possible time in our nation's financial history to put into place a brand new entitlement program that will be socialized medicine. It will cost us trillions of dollars, and where do we go to get that money? And this is what it means for senior citizens. President Obama stole over $500 billion out of Medicare to put it into Obamacare. So you have senior citizens right now, because we do have Obamacare, who when they go to the doctor, I'll give you one story. I was in Rock Rapids, Iowa. It's already happening here in Iowa. One doctor stood up in a town hall meeting I had, and he said, let me just tell you what it's like now under Obamacare. He said, I'm so sick of it as a doctor, I'm thinking about quitting. He said, I had a woman on Medicare in my office, and do you know who's enforcing Obamacare? It's the IRS, the Internal Revenue Service. 16,500 new IRS agents were hired to enforce Obamacare. So this doctor had to go on the phone and get a number from the IRS before he could see this little old lady on Medicare. And he said, I want you to guess how long I sat and waited on the phone during office hours with this patient in my office, waiting on the phone with the IRS, just to get one number before I could see her under the new Obamacare requirements. And he said it was 2 hours and 20 minutes. So this medical doctor sat doing nothing, the patient was doing nothing, and then all of the other patients were stacked up in the waiting room. And this is the beginning of the hassle that we'll get with Obamacare. We're not getting new doctors, we're not getting new nurses, we're not getting new cures, we're not getting new hospitals. What we're getting, in all likelihood, will be the largest bureaucracy that you've ever seen. Because the average federal employee now makes over $123,000 a year. The average person in the private sector makes $61,000 a year. Those are wage and benefit packages. And so these will all be federal employees, and it's just the beginning of a disaster, and it's the beginning of healthcare rationing, where we're all going to pay more. President Obama said, if we pass Obamacare, you'll see a $2,500 savings per household in the price of your health insurance premiums. Nobody's seen that. Instead, the prices have jacked up. And so what's happening now is we're seeing rationing of care, where people are getting less care because there's a 15-member board now that makes all the health care decisions in the United States. Did you know that? This is what Obamacare gave you. It's called IPATH. 15 political appointees on a board make all the major health care decisions for the United States.
She's not answering my
And
question.
so these 15 people may say, hey, we're running out of money. And so we're going to have 10,000 hip replacements this year. Well, great if you are in the first 10,000. But what if you are 10,001? Well, you're out of luck. Because under Obamacare, there's no right of appeal. There's no ability to sue. You're out of luck. And you just go without. That's the future and the face of Obamacare. And so that's why I am dedicated. I wrote the bill to repeal Obamacare. And instead what I want to do is allow all of you, you can't do this today, because every state has an insurance monopoly. And you can only buy the insurance in your state, according to your state rules. I want to get rid of those monopolies that the insurance companies have. I want you to be able to buy any insurance policy you want anywhere in the United States. No minimum federal requirements. Pay for it with your own tax-free money. Pay for the insurance, the copay, the deductible. If you need pharmaceuticals, if you need medical devices, if you need a chiropractor, pay for it with your own tax-free money.
What does this have to do with
and then
national
have
service?
true medical. Well, because it's the price. It's the price that you pay.
So screw the sick and homeless?
Oh, God.
Let's be
Who said
respectful. You have. Let's be
You're
respectful.
you could not be further from the truth. You're looking at someone who lived at below poverty. Have you ever lived at that, Abe?
Yes.
Have you? I have. I know what it's like. And I know what I had to do. I got a job. That's what you need to do. You need to figure out how to get a job and make your way. And then it is out of your excess that you're able to reach out and help. That's why we brought 23 foster children in our home, to help them. That's why we started a school for at-risk kids, because we wanted to be a part of the solution, not a part of the problem.
One final question.